Caherlick, yesterday we announced a health budget of €23.4 billion for 2023. It represents an additional €1.1 billion in current expenditure and €117 million in capital expenditure. It includes over €250 million for new measures. This brings the core health funding to over €22.5 billion. It includes a once-off allocation of €757 million to deal with COVID-19 and the ongoing impact and damage that COVID-19 has had on public health and on our healthcare system. This investment shows that government is fully committed to delivering on the vision of universal healthcare, a public healthcare system that provides everyone with affordable, high-quality care when they need it. My focus in Budget 2023, as it has been since I was appointed Minister for Health, is on improving affordability for patients, improving access to services, and extending and improving services for patients. There's no doubt that we're facing uncertain times this winter. As part of the wider plan to tackle the cost of living pressures, I'm introducing measures to improve the affordability of healthcare. I'm very happy to announce that Budget 2023 has provided an extensive package in additional funding for new measures, as well as very significant money for once-off measures. This funding will allow us to make GP care free for hundreds of thousands of extra people, those who are on or below the median income. It's a landmark move, and it will ensure that more than half of our population will now have free access to GP care. We're abolishing inpatient charges for hospitals completely from April. Charges for children have already been abolished in the last few weeks. Soon, adults will no longer face these charges, which can amount to €800 a year. I could not, as Minister for Health, stand over having debt collectors pursue patients for money that was technically owed for vital healthcare they received in our public hospitals. I'd like to acknowledge that very many groups, including, I think, a special mention for the Irish Cancer Society, who've campaigned so hard and so well on this issue. We listened carefully and we have acted. Another measure that's being introduced in this budget is an extension of free contraception. We're extending it to cover women aged 16 to 30 years of age. Women's healthcare, as deputies will know, has been a priority for me, a priority for the Ministers of State, a priority for this government since this government came to office. We launched the first ever women's healthcare plan earlier this year. Now we're continuing to fund additional services through into next year. We're going to deliver a Hpv Catch-Up Program to girls and boys at school and to women aged up to 25 years of age. The Catch-Up Program is due to commence before the end of this year. As I said some months ago, I'm determined to see that women and couples can access IVF in our public health service. This is going to take time to phase in, as we know. I've secured funding for €10 million to support access to IVF through Budget 2023. But I want to be clear, this is just the beginning. My goal is to have a publicly funded system that is accessible to all who need to avail of IVF services. On top of these measures, I'm also pleased to deliver, along with Ministers Butler, Fian and Rabbitte, extra one-off funding for 2022 for the coming winter of €110 million to support community-based voluntary organisations. They are an essential pillar in the provision of health services right across our country. This fund is being made available in recognition of the challenges being faced by the sector, those challenges they have in delivering and maintaining health and social care services against a backdrop of increased inflationary pressure. A detailed plan to disperse these funds is being finalised. It's very clear that some patients, too many patients, face unacceptable delays in accessing healthcare. For next year, I've secured overall funding of €443 million. This is specifically targeted at tackling waiting lists and getting people the care they need when they need it. It includes recurrent funding for the HSE, as well as funding for the National Treatment Purchase Fund. It includes additional funding for the provision of GP diagnostics, one of the great successes in our move towards integrated and universal healthcare. Very significant resources are also being allocated for the continued implementation of the national clinical strategies. These have received unprecedented levels of funding in recent years. We're also funding a number of new strategies for the first time, which we're particularly delighted to be doing. These include in stroke, bariatrics and obesity, national genetics and genomics, diabetes and neurorehabilitation. Budget 2023 funds our ongoing COVID response, but more than that, it's also about making healthcare affordable for people. It's about improving access to care for patients. It's about building and extending and improving services. It's also about building capacity. Over the past 2 years, this government has delivered record increases in hospital bed capacity, record increases in critical care capacity, record increases in the number of healthcare staff working right across our health services. We've hired more than 15,000 staff since the start of 2020. It includes 4,500 nurses and midwives, 2,300 health and social care professionals, 1,400 doctors and nurses. 2020 and 2021 have seen the biggest staff increases since the HSE was established. We have made real progress in addressing a long-standing deficit in critical care capacity and in other areas, including workforce. In 2020, we had 255 critical care beds. We're on track for the end of this year to have 336, and we'll be moving forward quickly. We are delivering. We have a very clear plan. Budget 2023 reaffirms this government's absolute commitment to universal healthcare.
Thank you, Minister. Minister